Welcome to the Surgical Edge podcast for surgical insights, reviews, discussions, and to stay updated. Let's dive in.
Okay, let's unpack this. You've sent us a stack of fascinating sources on Sir Keir Starmer's new 10-year plan for the NHS in the UK, launched just this past July.
That's right.
And it's being pitched not as just, a minor tweak, but a really significant transformation.
Absolutely monumental.
So our mission today is to cut through the noise, really get to the heart of it, the vision, the core reforms, how they plan to fund it all, and, well, what the real outlook might be.
And you really can't grasp how bold this plan is without understanding the context it came from. The NHS, post-COVID, it was widely seen as being, and frankly, an existential crisis.
Mm-hmm.
We're talking over 7 million people on waiting lists, chronic backlogs, unprecedented winter pressures, staff shortages just everywhere.
Yeah, it felt relentless.
And patient satisfaction was plummeting. Sir Keir Starmer himself put it very bluntly. Reform or die.
Wow. Strong words.
It wasn't hyperbole. It signaled that only deep systemic change, not just, sticking plasters, would work. This plan, the plan for change, sets out milestones all the way to 2035. NHS recovery is absolutely central.
And that phrase, reform or die, it really lands the sheer gravity of the situation, doesn't it? Beyond just the numbers, the waiting lists, we saw industrial action too.
Yes, widespread strikes.
Nurses, doctors. It painted a picture of a system just stretched to its absolute limit.
I think for anyone listening who relies on the NHS, that feeling, it's palpable.
Exactly. The traditional model, the way things were done, it just couldn't cope with the demands then, let alone thinking about future needs.
Right.
So that urgency, that sense of being truly on the brink, that's the backdrop for these incredibly ambitious changes we're about to get into.
So given that context, Starmer's plan isn't just fiddling around the edges. It brings in what they're calling the 3 big shifts.
Mm-hmm.
These are meant to be fundamental changes in how healthcare is thought about and delivered. Where do we start with these? Okay, the first big shift is from hospital-centric to community-based care. This is about decentralization, a massive recentering, really.
Moving things out of the big hospitals.
Precisely. Pulling services away from those overloaded hospitals, bring them directly into neighborhoods. The plan is to set up between 250 and 300 new neighborhood health centers across the country.
Okay, what would those centers actually do?
Think of them like comprehensive hubs. They plan for them to be open at least 6 days a week, 12 hours a day, offering diagnostics, mental health support, rehab, dentistry, even social support, all under one roof.
Right, making it more convenient.
And they're also meant to host outreach teams, paramedics, health visitors, volunteers. The idea is to catch illness earlier, reduce the pressure on A&E, basically bring care much closer to where people actually live.
That does sound like a radical change from how things often work now. So if community care brings services closer, what about making the system itself easier to use, more efficient? What's the next shift?
Well, the second shift tackles that directly. It's from analog to digital. This is pitched as a full-scale digital revolution for the NHS.
Okay, how so?
The main goal is to make the NHS app the real front door to the health service by 2028.
Integrating everything.
Pretty much. Booking appointments, seeing your health records, getting repeat prescriptions, virtual consultations, even data from your wearables, like smartwatches.
Interesting.
And a big part of this is a push for a unified electronic patient record across the whole NHS. Imagine not having to repeat your story every single time.
That would save a lot of hassle and clinician time, presumably.
Exactly. Reduce repetition, cut down the admin burden. And they're planning to use AI tools, too.
AI? In what way?
Things like AI scribes for doctors so they spend less time typing notes, predictive analytics to try and reduce missed appointments, even AI-assisted stethoscopes and triage systems. The real point here isn't just tech for tech's sake. It's about streamlining how things work, giving patients more control with their data, cutting waste, and, critically, freeing up clinicians' time for actual care, getting more bang for the buck. Essentially.
That digital side, it sounds, potentially transformative, but you always hear concerns, don't you? Cybersecurity, people who aren't comfortable with tech, the cost. Does the plan talk about that?
It touches on it. The unified record, for instance, they say, is being designed with security and interoperability baked in, learning from, let's say, previous NHS IT projects. And the community hubs could potentially help bridge that digital divide, offering face-to-face help. But yes, the main focus in the pitch is definitely on the efficiency gains, which they argue will free up resources to manage those other challenges.
Okay, fascinating. So we've got community-based care, digital first. What's the third big shift? You mentioned it briefly.
Yes, the third shift is from treatment to prevention. This is about thinking longer term, moving beyond just fixing people when they get sick.
To stopping them getting sick in the first place.
Exactly. Actively preventing illness. So that means expanding vaccinations, better early diagnostics, scaling up things like weight loss support and smoking cessation programs.
Okay, the standard public health stuff.
Well, yes, but it goes further. They're talking about regulations on healthier food, on alcohol, public health campaigns like calorie caps, improving school meals, even reward systems for healthy behaviors.
Rewards. Interesting.
And for people with chronic conditions, things like wearables and remote monitoring are set to become standard by 2035. The bigger picture here is the long-term impact. Invest in prevention now.
And reduce demand on the NHS later.
Precisely. Relieve that massive long-term pressure. Foster a healthier population. It's about changing the focus from sickness to health.
Those are genuinely huge ambitions, aiming to rewire the whole system. But you mentioned the NHS was in crisis now. What about immediate actions, tackling those massive waiting lists today?
You're right. Vision needs action. And the plan does include very specific near-term measures. Labor pledged, and the sources say they've delivered 2 million extra elective appointments in their first year.
That's a big number.
It is. And for waiting times, the target is hitting 65% of patients seen within 18 weeks by the end of 2026, then pushing that up to 92% by 2029.
Ambitious targets. How?
Through several things. Expanding community diagnostic centers, those hubs for tests and scans, giving them extended hours, aiming for about 500,000 extra tests a year.
Right.
Plus 14 new surgical hubs and expanding 3 existing ones to do more operations away from the usual winter pressures. They're also incentivizing evening and weekend clinics to speed things up.
And what about private sector's role? There was talk about that.
Yes, that's significant too. New NHS agreements with private hospitals are planned to add about 1 million extra outpatient slots each year, a public-private partnership approach.
Okay.
So these are definitely designed as aggressive, immediate actions to cut the backlog, while those bigger shifts, the community and digital changes, start to take root.
That's a lot happening very quickly. But none of it works without, well, money and people. Funding is obviously key, and the workforce. That's crucial. How are they actually paying for all this and finding the staff?
The million-dollar questions, or rather billion-pound questions. Chancellor Rachel Reeves confirmed around 29 to 30 billion pounds in NHS investment within this current term.
Okay, a significant sum. But is it enough for this scale of change?
Well, a big part of the plan relies on achieving productivity gains, aiming for 2 to 4% annually.
What does that actually mean? Productivity, just cuts?
Not necessarily just cuts. It means things like using that AI scheduling to avoid wasted slots, digital records, reducing paperwork, streamlining how patients move through the system, getting more healthcare output for each pound spent. That's the idea for financial sustainability.
And where's the initial money coming from, besides hoping for efficiency?
There's capital spending, like $1.5 billion specifically for those new hubs, and potential revenue from taxing non-resident wealthy individuals, plus some public health levies. But crucially, no general tax rises were announced. It's pinned on efficiency and targeted measures.
Okay, so avoiding general tax hikes for working families was a key message.
That was the stated goal, yes. Rebuild the NHS without that broader tax burden.
And the workforce side, you mentioned 100,000 vacancies earlier. How does the plan address that?
It's a huge challenge. The plan includes reforms for GPs, promising more resources, specialist support, and tackling that 8 a.m. appointment scramble.
Which everyone hates.
Indeed. For dentists, there's a plan for newly qualified ones to commit to some NHS work for a few years to boost retention.
Right.
And the plan stresses staff are central, particularly nurses having key roles in the new neighborhood centers. Structurally, they also plan to abolish the NHS England bureaucracy, shifting control back to the Department of Health over 2 years.
Aiming to cut management layers.
Reduce duplication, streamline things, and hopefully boost morale and delivery efficiency. That's the aim.
So we've laid out this ambitious vision, the immediate actions, the funding ideas, but plans this big always face hurdles, don't they? Yeah. What are the main criticism or potential problems people are pointing out?
Absolutely. And here's where it gets really interesting. First off, there's what critics call a detail deficit.
Meaning?
Meaning that while the vision sounds good, Groups like civil society organizations and unions are saying it's quite thin on the ground when it comes to the specifics of how it will all be implemented. The what is clear, the how is less so.
Okay, a lack of granular detail. Makes sense.
What else? Then there's the staffing crisis itself. You've got roughly 100,000 vacancies. So the question is, can you realistically expand all these new hubs and centers without just stretching the existing workforce even thinner? Where do the extra people come from?
A very fair question.
Fiscal pressure is another big one. Skeptics are questioning whether those 2-4% productivity gains are actually achievable year on year. And if they're not, does that put pressure on other public services to fill the gap?
Right, the money has to come from somewhere.
There's also concern about relying on the private sector. Critics worry that outsourcing more routine care, even via partnerships, might undermine the core public NHS over time.
A long-standing debate.
And finally, integrating with social care. The plan mentions it's important, but the details are really sparse. They're waiting for a separate review in 2026. But everyone knows you can't fix the NHS without fixing social care too. So all these challenges, the details, staffing, money, private sector roles, social care link, they suggest this transformation needs huge political will, a lot of time, and constant focus to actually pull off.
So with all that complexity and those risks, how will we know if it's working? What are the milestones we should watch for? What's the realistic long-term outlook here?
The plan does have specific targets. That 18-week waiting time measure is key. 65% compliance by 2026, aiming for 92% by 2029.
Okay, measurable progress.
We've already seen the delivery of those 2 million extra elective slots, which was an early pledge. And apparently, NHS waiting lists did fall for 4 months straight after the election, which is a positive sign.
Right.
On the digital side, they want 85% of acute trusts fully supporting the NHS app features by March 2025. That's quite soon.
Very soon.
And for the community rollout, getting those 250, 300 neighborhood hubs up and running, expanding the diagnostic and surgical hubs over the next few years, those are tangible things to look for.
And Starmer himself said this wouldn't be easy, right?
Exactly. He acknowledged it won't be universally popular and stressed it would take a decade. There seems to be initial cautious buy-in from nursing unions and think tanks, but everyone adds the same caveat. Execution is everything. So if it is successful, this 10-year plan could genuinely reorient the NHS, make it more accessible, preventative, digital, community-focused. But those big tests remain. Finding the staff, keeping the funding disciplined, and making that integration with prevention and social care actually happen.
Is certainly a bold, maybe even radical plan, trying to reshape the NHS at such a fundamental level. A real reform or die moment, as you said at the start.
Absolutely. And maybe this leads to the final thought for you, for everyone listening to consider. The ultimate measure of success here won't just be hitting those numbers, launching the hubs.
What will it be, though?
It'll be whether this whole endeavor genuinely manages to rebuild and, crucially, sustain trust from the public, trust from the professionals working within the NHS over the next decade. This is probably the biggest overhaul attempted in generations.
Okay.
Whether it works depends on detail, execution, funding, yes, but ultimately on rebuilding that confidence. That's the real challenge ahead.
Thank you for listening to the Surgical Edge podcast. Don't forget to like, share, and subscribe. Help us grow and deliver even more relevant surgical content by pressing the support button. Your contribution truly makes a difference. And don't forget to share with us your advice, feedback, and the topics you would like us to include.